Okay. It's okay, it can get a little messy.
What do you want to do after high school? This question stresses out every single teenager because the truth is, we can't make up our minds about what we're going to eat for breakfast, let alone a whole career.
But with applications around the corner, we need to do something about it. Join us every Thursday at 1, where we interview professionals in a variety of careers, so that one day we can answer this stressful question with confidence in our choices and ourselves. This is Career Hunt. Hey everyone, today's career is all about compassion, sympathy, and caring. As you guys read in the title, today we're going to be talking about nursing. A nurse is a caregiver for patients and helps to manage physical needs, prevent illnesses, and treat health conditions. But their care extends beyond medications and therapies. They care for the patient's mental health. So they listen to their pains, soreness, and fears, and they comfort them. They also support the patient and their family while going through these difficult times. To become a nurse, you have to study about 4 years in university, but you can also split your program into 2 years at college and then 2 years at university, but depending on which university you're going to. So our guest today, she went to Fanshawe College for 2 years, and then she finished her last 2 years at Western University. And she really recommended this program, actually. So yeah, and they also get paid their median pay is about $34.5 per hour. So if you calculated that, you'll get about $71,000 per year. So yeah, that's it for me. I hope you guys enjoyed the interview, and I'm sure you will because our guest today is so sweet. Anyways, let's move on to the interview. Tell us about yourself.
My name is Janine. I've been a nurse for about 3 years now. I guess my journey to nursing started in high school. I originally wanted to take care of younger kids as a career, maybe a psychologist or something like that, but I knew I wanted to live in London, so I had to change it up a little bit. And I always knew I wanted to help people, so I found that nursing was a nice avenue and switched it up and didn't want to do kids pediatrics anymore, and now I take care of general surgery, so a lot of colon cancers, people with like bowel surgeries, that kind of stuff. Like I said, I wanted to help people, and I enjoyed working in the hospital. I did originally want to start off as a psychologist and help children, and then I realized that I kind of wanted to be more on the scientific field, so I turned towards biology, really liked the anatomy and everything about that, and realized that I wanted to work as a nurse, take care of people in the hospital. In the hospital, we have 12-hour shifts. In other places as a nurse, you can work in a clinic where it's a Monday to Friday job and you have weekends off. I work part-time, so my schedule is a little bit all over the place, but it's flexible enough that I can schedule some days off or not work weekends. In the hospital, we have day shifts and night shifts, so they are 12-hour shifts, so 7 to 7 a.m. or p.m. It's an adjustment when you work nights, but alhamdulillah, it does really well. Yeah, it's kind of a few different schedules. My first death was very hard to deal with. I never thought I would experience it, and it was very new because I was a fresh nurse at the time. It was an adjustment, but the nurses on my floor were very understanding and helped me cope with the struggles that I was feeling when he did pass away. It was just, yeah, it was hard to kind of fathom because you'd see them take their last breath, and it's very scary. But alhamdulillah, it's been a lot better now, and it's easier every time, unfortunately, that it does happen. But it's easier to cope when you have a team, and nurses work very well together. Regardless, 12-hour shifts can be a little draining at times, but it does fly by. You're constantly thinking of things to do. There's always something to do in the hospital. Patients keep you busy for sure. I mean, like, it depends on like how your patients are doing. So sometimes your patients are doing very well and the shift will be easy, and sometimes your patients can kind of fall through the cracks and not do so well, and that's when you're just like kind of have to always be on the ball. In the hospital, it's pretty great because you have the residents that you can call right away. There's the emergency healthcare team, it's called CCOT, Critical Care Outreach Team, that you can just reach. And if anything, we'd send them straight down to the ICU if we can't handle them on our floor. So it comes to that point, unfortunately, but like I said, the nurses on our floor, like, always hands-on if things get a little out of hand. And yeah, we pick up the pace together and make it work. It can sometimes be emotionally draining because you see people's lives. That's their temporary stay is in the hospital. So they do remember you guys in the hospital. Whereas for me, it's like an everyday, I'm always at the hospital for work. But for them, it's an adjustment. They're not used to this. It's a critical time for them. They're very emotional. And you just want to try and make them feel comforted in a time when they feel vulnerable and sick. So I guess, yeah, the emotional drainage can be a lot because you see them go through such vulnerable states. And sometimes you don't see a patient doing too well, and it can get to you. But we work pretty good together. You appreciate things a lot more when you see some people who are dealing with their health issues on a daily basis, and then you look at yourself and you're like, okay, like, alhamdulillah, like, I'm not in this state, and like, I'm not dealing with this. So you appreciate life a lot better. You appreciate your family, your friends, and their health and their family, and you kind of have an appreciation for those people because they go through their health issues on a daily basis, and it's a struggle for them, but it makes me appreciate our life around us. I don't think I could like, I've always wanted to take care of kids. It's something I've always wanted to do, and I still think about it to this day, but I definitely don't think I could handle it because kids are so vulnerable and emotional, and it's just, I already have a little bit of a struggle and it's a little bit emotional dealing with the older people, older patients, so dealing with younger kids can be really like a little emotional as well for myself, so I don't think I would ever change it. I like what I do. I think I want to eventually do more with nursing, maybe do my master's or yeah, something like that. If you're considering nursing, definitely try it, read about it, ask a couple nurses. Every nurse has a different journey, and there are so many different specialties in nursing that you could work on. So you can work with children if you want, with the elderly, with different populations. There's clinic jobs, there's outreach opportunities. So there is so much that you could do within nursing. It's just such a broad term. But ask around. There are a bunch of nurses who have different opinions. Most of them are positive, so yeah, reach out. We're always open to having conversations about this stuff. So this is the stuff we would use to dress a wound. If it was deep, we would pack it with something, but we're going to pretend that it's just superficial. Can I demonstrate on your hand? Yeah? Okay, so we'll just do it on your arm here, okay? Just pull a little bit. There we go. So right over here. First thing you do is hand hygiene. Always cleanse your hands, sanitizer or soap and water, whatever is available. And then you'll put on fresh set of gloves. Okay, we do have a dressing tray. This should be always sterile if you're going into a wound that's open, because you want everything that's going into the wound to be completely sterilized. Whereas this is already exposed to air, so there could be bacteria or microbes or anything that could enter the body and cause infection. So this completely is sterile. You'd wear sterile gloves. I didn't bring that with me, but if you who did have it, you'd wear that on. You'd put that on. So you would wash your hands, put gloves on, and you would cleanse the wound. So usually there is already a bandage on it, and I would take down the bandage with some clean gloves. And then once I take a look at the incision, I take a look, make sure that there's no bleeding, no excessive drainage, that the wound is well approximated, so they're closing well together, the tissues are closing good. And then Yeah, measure it with a Q-tip and like a ruler to see how deep it is or how long it is.
Okay.
And then once that's done, we cleanse it. You can use normal saline or you can use an alcohol swab. We're just going to use an alcohol swab just because it's clean.
Okay.
We're not going to make a mess. Okay, so alcohol swab. We're going to cleanse your hand here. It's just going to be a little cool. Clean the area. Let it dry a little bit. And then you can use, depending on the size of the wound, we have small gauze, medium, and large, okay? And then there's other packing stuff too.
Okay.
So with this one, we'll use a small piece. I have my gloves on. I'm gonna open it up. Okay, there's 2 pieces here. We'll just use one. We'll put it on the wound, make sure it's nice and dry. Good. And then it sticks because of the alcohol. And then you would just wrap it with a bandage or with one of these, depending on the size.
Okay.
So we'll just do it like this and wrap it around. Okay. And it's okay, it can get a little messy. There you go. And once that's done, you can just cut it with a pair of scissors, which I have somewhere. Hold on, right here. Get you to hold that for me. Okay, and then you just put a piece of tape. And that's the very easy dressings. Obviously there are like incisions that need more, but that's kind of the gist of it. And you want to keep an eye on it, make sure that it's not oozing out. If it is bleeding, it's not bleeding through the wound. If it is, you would notify the team if it's a lot, like notify the doctors to see if there needs to be a change in the dressing or if they have to take a look at the incision. Okay?
That's so cool.
Thank you guys so much for watching.
Don't forget to like and subscribe.
And comment down below if you think this job is a good fit for you.
And if it's not, comment down below which one you'd like us to do next time.
See you next time.
Bye!